Okay, we'll work on her mic. But right now, let's work with Dr. Williams. How are you?
Good
Dr. Jerome
morning.
Williams. And our Ask the Pet Doctor segment today. If you have a question, it is 741-9272. He is here today, along with Jillian.
Yes.
How are you?
Exciting week.
Go ahead.
Yes.
Where you went to school, so you can't help yourself,
Well,
right?
yes. We are representing Alabama A&M, which will represent well in the Classic Week this week.
All right, it is a big week here in Birmingham. All right, do we have a first caller at 741-9272? Do we have a, okay, 741-9272. Call in with your pet questions. Houdini's kind of got things a little crazy around here today.
Yeah.
So what are you seeing right now? What do folks need to be concerned about as we get into the fall months? Candy and animals, not a good mix, right?
Right, they're not a good mix. We're still having allergies, still seeing those. We had an unusual number of digestive problems lately. I don't know whether it's, again, the food contributing or what. But that's what we're seeing most right now.
And so are those easily to be fixed?
Yeah,
or,
most time they are. Most time they're easily fixed. Now, we're seeing a lot of fleas for some reason. Many times when the weather begins to change, folks feel they don't need to continue with the flea medication, the heartworm preventing medication, but we should stay on those year round.
Okay, Gabrielle is on the line. She's in Birmingham. Gabrielle, good morning.
Good morning.
Hey, what's your question?
My dog has been scratching at his ear a lot, and he's like shedding a lot of fur in the process. So I was wondering, why would he scratch at it so much?
Is it one ear or both ears?
It's just his left ear.
Okay, if it's one ear, you probably have an infection going on there. So it's something that needs to be seen, and it can be treated, I'm pretty sure, relatively easy. So get him to your doctor, have him take a look, and he can treat that for you.
Thank you.
Okay.
All right, we like to hear it when it's easily treated.
Yes,
yeah,
yes.
That's easy. Well, you mentioned fleas, and you're just seeing more fleas, or what's happening?
I don't know whether we're just observing it more.
Okay.
Like she mentioned, the scratching. Many times, scratching episodes like that is due to fleas, and they can create a bunch of problems. So we need to stay on top of those, both on the pet and in the environment.
All right, Stephanie's on the line now. Stephanie, good morning.
Hi, Stephanie.
Hi, how you doing?
Good. What's your question?
Well, I have a Shih Tzu, and she's about the size of a little buddy on TV, but she just started like this little dry cough, and it sounds like she's probably having sinus because she's making this little noise like.
Stephanie, how old is she?
3.
3. It's again something that needs to be seen. It's allergy season still. It could be allergy related. If you have just turned on your heat recently, and the mold and all that stuff that's in the ducts could be causing it.
So what would you do to look at that? What's the procedure to check?
Have your veterinarian check them and see what they think it is.
Okay.
But again, if we're changing seasons and cutting on the heat, the mold and other elements that are in the ducts could create respiratory problems and other problems.
Just from describing the cough, they could check into that and see what it is. Okay, good luck, honey. I hope you can get to a vet and see what's going on there. Suzanne is our next caller. Suzanne, good morning.
Good morning.
Hey, what's your question?
I have a little Chiweenie, and inside her ears there are scaly, scabby spots that are surrounded with a red circle. They're nowhere else on her skin. She's been treated with an antibiotic injection, and it didn't phase it at all.
Okay.
Any ideas on that?
It sounds like you got an infection of some sort. If it's only in those locations, you might need to have a culture done where they can actually take a swab and put it on a medium and find out exactly what it is. If it's an infection of a fungal or bacteria, it can be identified and treated successfully.
All right.
Thank you.
Hopefully that's all. Hopefully that's all it is.
Absolutely.
Take care of. All right. Well, have fun. Classic weekend.
Absolutely.
All right. Thanks, Jillian. Thank
Go
you.
Bulldogs.
Thank you all for calling in. Now here's Jay.